Now to the surge of the Omicron variant, which is driving cases up around the world. The U.S. is breaking hospitalization records. The Department of Health and Human Services is reporting over 145,000 COVID hospitalizations, thousands more than the previous record set this time last year. And pediatric hospitalizations, well, they are at the highest rate of the pandemic. The U.S. is reporting more than 750,000 cases and over 1,600 deaths every day. CBS News' Michael George has the latest.
The U.S. has set an all-time high for COVID hospitalizations. There are more than 145,000 people hospitalized as of this morning, surpassing the 142,000 record set last January.
Back in my state, hospitals are asking our state leaders to declare a crisis for our medical facilities.
Doctors Rochelle Walensky and Anthony Fauci told senators hospitals are struggling with both the influx of new cases as well as staffing shortages.
Underscoring why it is so important for the unvaccinated to get vaccinated and for those who are already vaccinated to obtain the booster shot.
Hospitals are also dealing with a shortage of blood. Supplies are at such a dangerously low level, the American Red Cross has declared the first ever national blood crisis. Hospitalization rates are also up for children, especially kids younger than 5 who are not yet eligible to be vaccinated.
The children who are in the hospital now are largely those who are unvaccinated.
The American Academy of Pediatrics says more than 580,000 children tested positive for the virus last week, also an all-time high.
Schools having enough testing supplies to stay open is a critical priority for us.
In Chicago, students are expected back in the classroom tomorrow after the city and the teachers union reached a deal allowing individual schools to switch to remote learning if there's a COVID outbreak resulting in teacher absences.
Teaching remotely is 5 times harder for me. I know it's hard on my students, but it's a last-ditch effort to keep the ICU beds open.
More than 5,000 schools across the country have gone virtual since the beginning of the year. Michael George, CBS News, New York.
For more on this, I want to bring in John Moore, professor of microbiology and immunology at Weill Cornell Medical College. Thank you so much for joining us. Dr. Fauci has said that the vaccine for children 5 and under likely won't be approved until the second quarter of this year. In the meantime, pediatric hospitalizations, as you just heard, are rising. Is Omicron more severe for children, or are more children just being infected because of how transmissible this variant is?
It's the latter. There's no evidence that this variant is going for kids in any unusual way, but it's a numbers game. The more people, the more kids who get infected, the more of them are going to end up in hospital. It's still a very low proportion of children who become severely ill. But when you get so many of them infected, then it's logical that a greater number of them will have significant symptoms and need hospital treatment. And that's just very unfortunate. And it is concentrated among unvaccinated children, which is why every parent with a child who's old enough to get vaccinated should get them vaccinated as soon as possible.
Yeah, I have an 8-year-old who just recently got vaccinated, and I think to hear that it's not as severe is always comforting, despite the number of children who have succumbed to coronavirus in the last 2 years. Omicron has caused Americans, of course, to become more reliant on rapid antigen tests if they can find one. Can these tests detect Omicron as well as the other variants?
It looks like no. There's something unusual about Omicron. Well, there are a number of unusual things about Omicron, but one appears to be a reduced sensitivity for detecting Omicron on nasal swabs, the standard method, in a critical approximately 2-day window when you may have mild symptoms, you're capable of transmitting the virus to someone else, but the tests come up negative. And CDC, the FDA has been looking into this for weeks now, and we still don't have a definitive statement about this. And I believe there's pushback from the kit manufacturing companies on this issue. They're really not keen on the full facts coming out. But the facts are that these kits are failing to detect Omicron in a critical 2-day window. Now, whether that's because there is less virus in the nose, the region you access in the, the very close to your outside of your face, I mean, just the nasal vestibule, there may be less virus in there, but there's more virus around further back or in the mouth and throat, perhaps, and it can still be breathed out, sneezed out, transmitted, but you're just less able to detect it on a standard nasal swab, and that's a real problem. We have to face up to this.
And I understand we're still, learning and doing studies and research on those tests that you're saying are not as reliable with Omicron. But where does that leave us as a country when you hear the president saying he's trying to get more of them so people have access to them at home?
Well, they're useful when they give you a positive result. So if you get a positive result in an Omicron rapid antigen test, it does mean something. It means you're infected. And it can be helpful when you're at the end of a quarantine period. If you've gone for 5 or 7 days, I think everyone should be testing themselves to see if they are now going negative. And if they are going negative, it probably is it's a good sign for being able to go back to work, as does resolution of symptoms. If you feel you've recovered from what's probably going to be a pretty mild, head cold type of experience at home for a vaccinated person, then having an additional test after 5 to 7 days that comes in negative is another good sign that you're fit to go back to work. But this has been very controversial. Another issue that needs resolving pretty quickly now.
The CDC director, Rochelle Walensky, had to defend the agency's updated isolation guidance in a Senate hearing today. I want you to take a listen to what she had to say.
A core part of CDC's mission is to translate science into recommendations for best practices and real-world circumstances. Over the holidays, we saw the growing surge of Omicron and took swift, science-based action to address the very real possibility of staffing shortages in hospitals and in other essential areas of the workforce. This is the right guidance for what we currently know about transmission and the real-world circumstances we currently face.
Professor, if you could quickly, why do you think messaging is still a problem for the CDC?
Well, it's a very rapidly changing environment in terms of knowledge accumulation. I mean, every day or every few days we learn something more, and I think you have to evolve your strategy accordingly. But, whatever the messaging problems, the public still remains confused. And my clinical colleagues, I'm not a clinician, but I talk to physicians, I talk to hospital staff. They don't like the idea of returning to work at 5 days. They feel uncomfortable about it on a personal level. They feel they're increasingly likely to be exposed to patients who are still infectious. But you also understand why there's a need to get people back to work as rapidly as possible, because a sick out on a mass scale does compromise public services. Everyone gets that. So it's a very tricky balance between the need to keep people working and the need to avoid people at work then passing the virus to their colleagues. And, not everyone's the same. Some people will have a very mild infection and clear it in a couple of days. Other people will go on well past 7 days. And there's still Delta around, which causes a more severe infection. So, everybody's got to use common sense and best personal judgment on a system if necessary.
All right, Professor John Moore with the tough truth for us. Thank you so much.
You're welcome.